Hi, I'm Ku Yunyi, a PPISB student in Institute Pendidikan Guru, Campus Pulau Pinang. In this discussion, I will play a role as an anesthesiologist, which is a doctor who will give the drugs to the patients to decrease their pain during surgery.
Hi, I am Lim Siu Hui, a student of PPIS SMP from Institute Pendidikan Guru Campus Pulau Pinang. I also will play a role as psychiatrist during this discussion, which is a doctor who works with people with mental, emotional, or addictive disorders.
Today, our group discussion theme is about health, entitled The Effects of Drugs on the Nervous System. Nowadays, the number of addicts in Malaysia is increasing at a high rate.
Yes, you are right. Based on the statistic of drugs in Malaysia, the National Anti-Drug Agency Malaysia showed that the majority of drug addicts were men.
Wow, that's a frightening situation in our country. We can see the drug abuse on the news in social media almost every day. For example, Facebook and Instagram. So, what is a drug actually?
Drugs are chemicals or substances that change the way our bodies work. Some are medicine that help people when doctors prescribe them. Many of them have no medical use or benefits, but some have. As I know, drug addicts suffer damage to their nervous system if people use it exceeding the normal doses. Have you ever heard of the nervous system?
Yes, I heard about it. The nervous system is a complex collection of nervous and specialized cells called as neurons that transmit signals between different parts of the body. It is essential to body electrical wiring. Do you know more about it, Dr. Lim?
Sure. The nervous system is made up of two main systems in the body. That is the central nervous system and the peripheral nervous system with different functions. The central nervous system consists of the brain and the spinal cord, while the peripheral nervous system includes all the nerves that extend from the spinal cord to the entire body. Dr. Koo, do we have any idea about it?
Yes, Dr. Lim. Together, they transmit information throughout the body to guide our bodies through basic functions such as thinking, eating, walking, driving, and running. In addition to this, the nervous system performs other functions such as releasing hormones needed for metabolic activity in our body, controlling an active heart rate, and protecting neurons and neurotransmitters. Can you give more about example of drugs that will give effect on the nervous system?
First of all, one of the examples of drug is inhalants. Inhalants are harmful because they have various chemical substances inside it, plus we cannot see it with our eyes. For your information, inhalants refer to chemical substance that people will use take only by this way, which is inhaling. This is because most of the items that can be used as inhalants are gases. They will breathe in the gases through the lungs. Basically, people will use it by sniffing, snorting, begging, and huffing. Dr. Koo, can you explain it more detail?
Inhalants contain dangerous substances that have psychoactive or mind-altering properties. It is the only substances that young people use more than older teenagers because it can be easily purchased at home or at work, such as glue, correction fluid, and spray paint. Although the aerosol produced by inhalant usually lasts only a few minutes, but people often try to use it last by continuing to inhale again and again. Thus, what are the effects of inhalants on our nervous system?
When a person takes an inhalant, chemicals in the inhalant such as nitrogen oxide send instruction to the brain to keep releasing dopamine. Dopamine is a neurotransmitter that brings happiness. Consequently, this process makes a person feel euphoric for hours on end, even though his body no longer needs dopamine. Thus, inhalants can harm our nervous system, but there are some differences between its short-term and long-term effects. Do you know what is an example of short-term and long-term effect, Dr. Khoo?
Inhalers have many side effects if people take it in high dose, which are short-term effects and long-term effects. Here are some short-term effects that can destroy our health. Firstly, they will feel high in their mind and hyperactive while taking the inhalant, especially during night. This is because their thinking is abnormal when they are drinking. They will also take the inhalant at the same time repeatedly. As a sequence of these issues, they cannot control their body to stop thinking about inhalant. They seem like they are already super addicted to the inhalant and couldn't live without it one day. On top of that, if someone takes an inhalant for a short period of time, he or she will experience slurred speech or distorted speech. This person will also lack of coordination, just like someone taking hallucinogens. He or she will also lose control of her body movements. Dr. Lim, what are the effects on the nervous system if someone takes inhalant for a long term?
Inhalants have many long-term effects that can make our life changing badly. This is because drugs contain so many chemical substances that can easily be absorbed in our organs. The most dangerous effect from inhalant is that it damages our brain. That means the electrical impulses cannot transmit efficiently to the nerve cell as usual. Our response and coordination of the body will become slow and non-active. For example, our body will respond slowly compared with normal people. Inhalants will affect our brain development in future because their brain is not fully developed yet. Maybe they will have premature thinking and mindset in the upcoming days. This surely will affect their growing up process. Dr. Khoo, can you give me another example of long-term effects?
Sure. On the other hand, if the person takes drugs for a long time, he will face liver and kidney damage. Inhalant can reduce hearing range and cause problems in the brain, leading to the delayed behavioral development. Inhalant will also cause irregular or rapid heart rhythm, which will cause the heart to stop delivering blood to the rest of the body and lead to the sudden sniffing death syndrome. In addition, high level of chemical in our body will displace oxygen from the blood. The cells in the lungs and brain lack oxygen. Besides inhalant, what is the other drugs that can affect on a human's nervous system?
Stimulant is also one of the drugs that we know. Actually, stimulant refers to psychoactive drugs that will contribute to improvement in physical or mental functioning in our body. Stimulant is a class of drugs that speed up message traveling between the brain and the body. Then, they can make a person feel more awake, alert, confident, or energetic. Stimulants can be in the form of tablets, capsules, and powders with a strong smell and bitter taste. For example, caffeine, nicotine, amphetamines, and cocaine. Can you explain the examples of stimulants, Dr. Khoo?
Sure. Caffeine is one of the stimulant items. It's usually found in coffee, tea, and cola. It will increase our blood pressure and heart rate. It will make our brain activity and nervous system become more quickly, such that the quantity of adrenaline hormones in our body will increase. Caffeine is possibly unsafe if used for a long time or in dose over 400 mg daily. Caffeine can cause insomnia, nervousness, restlessness, and other side effects. Larger doses may cause headache, anxiety, and chest pain. Contrastly, it will help us to feel comfortable and relaxed if we use it in small doses and wisely. Can you explain about nicotine?
Nicotine is the chemical in tobacco that keeps you smoking. Nicotine reaches the brain within seconds of taking a puff. In the brain, nicotine increases the release of brain chemicals called neurotransmitters, which help regulate mood and behavior. Besides, dopamine, one of these neurotransmitters, is released in the reward center of the brain and causes feelings of pleasure and improved mood. The more you smoke, the more nicotine you need to feel good. Nicotine quickly becomes part of your daily routine. So, how about amphetamines, Dr. Khoo?
Amphetamines are stimulant drugs. They make the message between your brain and the body move faster. As a result, you are more alert and physically active. Some people use amphetamine to help them stay awake on the job or to study for tests. Others use them to boost their performance in sport. Amphetamine can cause birth defects when during pregnancy. Also, street drugs are not safe during breastfeeding. Addiction happens when you are using amphetamine to get high or to improve performance. Addiction means your body and mind are dependent on the drugs. You are not able to control your use of it and you need to get through daily life. Other than amphetamine, what is another example of a stimulant?
Cocaine is powerfully addictive stimulant drug made from the leaf of coca plant native to South America. Cocaine increases levels of the natural chemical messenger dopamine in the brain's circuits related to the control of movement and reward. Normally, dopamine recycles back into the cell that release it, shutting off the signal between nerve cells. However, cocaine prevents dopamine from being recycled, causing large amounts to build out in the space between two nerve cells, stopping their normal communication. This flood of dopamine in the brain's reward circuit strongly reinforce drug-taking behaviors. With continued drug use, the reward circuit may adapt, becoming less sensitive to the drug. As a result, people take stronger and more frequent doses in an attempt to feel the same high and to obtain relief from withdrawal. From these examples, can you conclude the short-term effects of the cocaine, Dr. Khoo?
At the same time, if we take stimulant for a short time, it will cause trouble to our health. Short-term effects is that people will have weight loss. This is because they do not have good taste to eat after having too much stimulant. They will always think about stimulant all the time. Therefore, our body's organ will become non-active. Surely, stimulant will change our lifestyle badly. Is there any long-term effect of stimulant on our nervous system, Dr. Lim?
The long-term effects of abusing stimulant is stroke. If you lose all of part of your field or vision after a stroke, the brain might generate image to fill in the missing areas. These types of hallucinations are usually temporary but may last for several months before reducing. Apart from that, the hallucinogen can appear as simple patterns or complex images of people, place, and objects. This can include hearing voice, which may seem to come from inside or outside your head. They could be friendly or critical. You might hear music or odd sounds. You might hear sounds along with a visual hallucinations. People take stimulants for a long term while also facing the problems such as reduced sexual functioning, cardiovascular damage, breathing problems, and headache. Besides stimulants, what is the other drugs that can have effects on a human nervous system?
Other than stimulant, hallucinogen is also an example of drug that will have effect on our nervous system. A hallucinogen is an illegal drug that can change a person's perception of reality. It is usually manufactured synthetically or derived from plants. This drug will produce hallucinations. People who use hallucinogens regularly will experience flashback. Dr. Lim, can you please share some examples of hallucinogens?
Here are some examples of hallucinogens, which are LSD, ketamine, and PCP. Both of them are chemical hallucinogens. However, magic mushroom, mescaline, and ayahuasca are natural hallucinogens. People who are stressed or depressed will take medicine, which is pills or capsules that contain ketamine inside. It can help them to feel relaxed. Dr. Khoo, can you explain more about ketamine?
Of course I can. Ketamine is an example of a hallucinogenic drug. People who experience problems or stress in their daily life, at school or at work, may take pills or capsules containing ketamine, or also known as special K. Most importantly, ketamine affects to the glutamate system in our brain, which is used to control communication. Low doses of ketamine stimulate transmission of neurons between a person's brain cells. Therefore, low doses of ketamine are said to be an agnostic drug. At the same time, high dose of ketamine block the transmission of glutamine. As a result, it is difficult for nerve impulses or signals to travel from one brain cell to another, and our brain automatically shut down. Apart from that, what is a magic mushroom?
For your information, magic mushrooms work by activating serotonin receptors. This part of the brain affects mood, cognition, and perception. It does not always cause active visual or auditory hallucinations. The effects of magic mushroom are generally similar to those of LSD. Besides, taking magic mushrooms also can produce physical effects, which are darkness, particularly in the face. It also can increase heart rate and blood pressure. At the same time, it can also produce dry mouth, sometimes leading to vomiting. Dr. Khoo, actually I am quite confused about mescaline. Can you explain it more detail?
Alright, mescaline is a hallucinogen obtained from the small and spineless cactus. It is also found in certain members of bean family and can be produced synthetically. Usually, the top of the cactus above ground is cut from the root and dry. These buttons are generally chilled or soaked in water to produce an intoxicating tea. It can be assumed raw or dry, but is actually bitter. The hallucinogen may also be ground into powder for oral capsule or smoke with tobacco. The hallucinogenic experience typically begins in 60 minutes after consumption and lasts about 8 to 12 hours. However, different doses of hallucinogens can affect people in various ways, and doses extracted from plants can vary widely. Dr. Lim, can you have any detail to add?
Yes, I will share with you the effects of mescaline. Common effects during mescaline use may include visual hallucination and radically altered states of consciousness, open and closed eyes, visualizations, euphoria, dreamlike state, outer body image, slow passage of time, outer perception of space, laughter, and a mixing of senses such as seeing a sound or hearing colors. Research can found that mescaline may affect the factors of a pregnant woman using the drug. Thus, what is the last example of natural hallucinogens?
The last example of natural hallucinogens is ayahuasca. Ayahuasca is a psychoactive tea that originates from the Amazon region. Psychoactive substances affect the brains and cause people to experience change in their mood, thinking, and behavior. First, even though many of the unpleasant side effects that are usually experienced using an ayahuasca treat, such as vomiting and panic, are considered normal and only temporary, they can be extremely depressing. Some people report having miserable ayahuasca experience, and there are no guarantee that you will react favorably to the concoction. What's more, ayahuasca interact dangerously with many medications, including antidepressants, psychoactive medications, drugs used to control Parkinson's disease, cough medicines, weight loss medications, and more. Additionally, taking ayahuasca can increase your heart rate and blood pressure, which may result in dangerous side effects if you have a heart condition. So, it is clear that drugs, especially hallucinogens, can cause many negative effects on those who take them. If someone takes hallucinogen, it can have physical and psychological effects on our daily life. Dr. Lim, can you share some effects of hallucinogen on our daily life?
Hallucinogens will affect our bodies. It will increase the heart rate, cause our heart to pump blood at high pressure, increase breathing rate and body temperature, and sweat excessively. Moreover, the person will lose coordinate control of his body movements. Although he is walking on level ground, he can easily fall, and if it hits a vital part of his body, such as his head, it can cause serious injuries. He will also face hallucinogen persisting perceptual disorder or HPPD, a disorder that causes recurrent hallucination or other visual disturbance in people who take hallucinogens. So, do you know what are the physical effects of hallucinogens?
In addition, hallucinogens can also physically affect our daily life. hallucinogen can alter a person's sense of time. For example, people will feel that the time is passing very slowly. It can also cause many intense sensations and sensory experiences, such as seeing brighter colors and hearing louder sounds. In addition to this, hallucinogens cause a range of ongoing psychotic problems, or what is more commonly known as persistent psychosis. This leads to visual distributions, thought disorder, and mood changes. Thus, if we take hallucinogens, we are affected physically and physiologically. Hence, what is the conclusion in this discussion?
General speaking, drugs are very dangerous. Trust me, it will destroy someone's future. The country development will also affected. This is because the crime issues of drugs will increase in our country. The dignity of country will be pretentious, so the foreign investment will quit from the industry sector. It will cause the economy of the country to become worse compared with another rich country. The living standards of the resident also will become worse. Consequently, the working opportunity for the resident will decrease day by day, and the rate of unemployment will increase. Many people think that drugs can bring happiness in their life. Actually, it cannot help people to solve their problems, but it just makes them become worse. Talk to the family if you face some problems, because the family is the biggest support system for us. This is because parents have many useful experience and will give you some advice that can help you to make the best decision. What is your opinion, Dr. Koo?
In my opinion, drugs have many negative effects on nervous system, and it directly leads our daily life into dangerous situations. Therefore, the authorities should do something about this situation before it becomes serious. As the saying goes, prevention is better than cure. Authorities can organize more activities that include not only teenagers but also parents, as they are the most important role model for their children. The authorities can also share information about drugs through social media, because it is an age of airliness. This is because most of the sources and information come from media social, which is the main medium in this area. I believe in this new generation who are drugs free and have a positive mind and healthy body will contribute in the development in our country. Do you ever try eat drugs? Stop it before you regret it. Thank you.
That's all from us. Bye.